Ever since I've been in practice, patients have asked, is there a way of treating cellulite? And over the past 20 years, there's been many attempts to treat cellulite. Most of those attempts work a little bit, and they continue to work as long as the patient is having the treatments, whether it's entomology or lotions or potions or things like Cellulaze. About a year ago, I was moderating a panel at the Vegas Cosmetic Surgery meeting, and Dr. Barry DiBernardo from Montclair, New Jersey, presented his initial findings about Cellulaze, a new treatment that uses a laser to address the 3 anatomic conditions that cause cellulite. And as with any new technology, I was quite skeptical. His initial results were quite impressive, that with a single treatment, 90% of the women who were treated were still happy a year later with their treatment. So I've followed that for the past year, and actually I was able to moderate another session at Vegas Cosmetic Surgery 2012, and was quite interested to hear both Dr. DiBernardo and Dr. Jason Posner from Florida, who's incorporated the technology into his practice, say that now they have 3-year results that are showing that with a single treatment, again, 90% of the patients are still happy out 3 years, and that's as long as the treatment's been being performed. So it looks like we have now a single treatment, one time, that will correct cellulite in a great majority of the patients. And what we're hearing is the 10% that aren't happy are probably patients that weren't chosen properly. They probably had way too severe of a case of cellulite and probably needed liposuction. What's nice about the procedure, again, it's a one-time treatment. Patients do need to plan accordingly because there is some significant bruising for about 3 weeks. They have to wear compression garments, but the improvement is seen approximately 1 to 2 months after the treatment and continues to improve for 6 months. It plateaus at about 6 months and then remains stable. The process is minimally invasive. It uses a one-of-a-kind laser that is placed just below the surface of the skin. So a small little nick is made in the skin, the laser is placed in there, and the laser is used not only to cut the bands that cause the cellulite by pulling the skin down, but then it is turned up to heat the fat bulges, and then lastly to heat the skin. So with this 3-pronged attack on cellulite, finally, after all these years, we have a way of correcting a condition that bothers probably 85% of the women in the world.